By the end of this lesson, you will be able to demonstrate an appropriate response to medical ethics issues. Now, we all have our own sense of honesty, fairness, commitment, integrity, and accountability. But this is our personal ethical code, what we believe as an individual. We have moral beliefs that tell us what is right and what is wrong. These beliefs are influenced by our culture and how we are raised. As we grow, our morals may change and evolve, and our beliefs may change. Our professions also have established codes of ethics. These are guidelines that are set by our professional organizations and sometimes set by our employers. The American Medical Association has a code of ethics for physicians. Similarly, the American Association of Medical Assistants has one for MAs, and the National Association of Phlebotomy Technician Professionals has a code for phlebotomists. You should become familiar with the code of ethics for your chosen career field. Overall, healthcare professionals' codes of ethics, at a minimum, include these 4 principles: autonomy, non-maleficence, beneficence, and justice. Autonomy, you can think of auto, is the freedom to determine one's own actions and decisions. So patients have the right to determine their own actions and to make decisions. The second is non-maleficence. I know it's a big word, but we talked about before is mal means bad, and non is not would be not, so not bad. So the easiest way to remember this is to do no harm. Healthcare professionals have an obligation not to harm their clients or their patients. Beneficence sounds like the word benefit, and that means to do good. So we have an obligation to do good for people. And lastly, justice. The principle of justice means to treat the patients fairly and give them the care that is due to them. Now, sometimes an individual's personal ethics clashes with their professional ethics, and it may be necessary to separate your personal ethics from your professional ethics. So you need to evaluate your own personal ethics and see if they compete with your professional code of ethics. Make sure you are in the profession that is right for you. Now, another part of this separation is that sometimes our codes of ethics, or what we believe, is different from what our clients and our patients believe. So you need to separate yourself and not share your personal beliefs with your patients. You want to choose your employer that aligns with your own moral compass, your own personal set of ethics. For example, if you don't believe in abortion, working in an agency that does abortions would not be a good choice for you. So look at your own personal beliefs and make sure they fit with your professional code of ethics before you enter your career. And then once you're in your career, make sure they fit with your employer's code of ethics before accepting a job. Now, one topic that frequently comes up in healthcare, particularly when we're talking about ethics and ethical decisions, is that of death and the care when we provide to someone that we know is dying. There's an act that was passed in 1990 called the Patient Self-Determination Act. And this act provides patients with a written document of their rights to make decisions at facilities, and so facilities have to respect the patient's decisions regarding their, for lack of a better word, death plans, their plans for the end of life. It laid out something called advance directives. And advance directives, advance meaning before, and directives, rules, points, guidelines. Advance directives allow a person to determine what procedures that they do and do not want performed on them when they are unable to communicate their wishes. Sometimes you'll hear people call these living wills. Okay. Now, within an advance directives, or a type of an advance directive, I should say, is a DNR, a do not resuscitate order. And it's an advance directive that indicates that a person is refusing to have cardiopulmonary resuscitation, CPR, if they stop breathing or have no pulse. The chart of a patient with a DNR order should clearly be marked so that all providers know the patient's wishes as soon as they look at that chart. Another document you may see is called a POST. POST, P-O-L-S-T, stands for Physician Orders for Life-Sustaining Treatment. And this is a one-page document that's completed by a physician that states the orders and care that a patient should receive. It should be based on the patient's advance directives and the patient's wishes. And it supersedes any other advance directives or living wills that the person has, because this is actually a paper that is a physician's orders. Really, they are very common in long-term care facilities. We see them a lot. And as I said, they outline what to do, what orders to put into place when a patient is nearing that end of life. Now, keep in mind that end-of-life decisions can be emotional for patients and for families, and can be ethically challenging for healthcare providers. So you need to think about where you stand on these issues, and remember they are your beliefs, and don't impose them on your patients. If patients can't make these decisions, it becomes up to the patient's next of kin or their healthcare proxy to do. So to wrap it up, ethical issues come up all the time in healthcare. We touched briefly on end-of-life issues with ethics, but there are many more, such as abortion, withholding treatment, cloning, genetic research, etc. There's a lot of ethical issues in healthcare. Ultimately, what you need to do is think about these issues, determine what your personal beliefs are, look at your professional code of ethics, and look at what your profession believes on these topics. Make sure that they work together and coincide. And then when you become offered employment somewhere, make sure that the code of ethics where you're going to be working also aligns with your personal and professional code of ethics. If it doesn't, you will need to be able to separate yourself in ethical situations so that you can still provide care following the principles of justice, beneficence, non-maleficence, and autonomy.